Hey, this is Sandy.
And Randy.
And we're here on AT Corner.
Being an athletic trainer comes with ups and downs, and we're here to showcase them all.
Join us as we share our world in sports medicine.
Welcome back to another episode of AT Corner. For this week's episode, we have an interview on ATs in the OR.
Wow, lots of abbreviations.
Actually, yeah. I didn't even notice that. That's pretty good.
Yeah, so athletic trainers obviously are in a lot of settings, but this is the first time that we've been bringing on someone who is consistently working in the OR with surgeries.
I'm going to be honest, that's pretty dope. That's a pretty dope job.
Really is. It really is. And no better person to talk to than Hailey Rushton.
Hailey received her bachelor's degree in athletic training from Southern Utah University. She is currently working on her master's of athletic training at AT Still, with her expected graduation in December of 2026. Hailey has had the unique perspective of initially working in the traditional setting, but then transitioning into the ortho clinic, and then that has translated into the OR.
Yeah, honestly, it's really cool to hear like the background and how she got there. And, you know, I'm not going to spoil the episode, but it is just really cool to see just the places that we can go as athletic trainers.
Absolutely.
So without further ado, let's hear from Hailey. Randy, you want to get us started?
Yes, absolutely. So always got to start with a good cryo breaker. What sort of athletic training tool, tape, brace, manual therapy, or in this case, something in the OR clinic, represents you as a clinician?
Yes. So I have thought about this, and I even asked some of my coworkers about this. I'm like, guys, I don't know what would be the best thing for me. And the physician I work with, he said, well, tape, because athletic trainers use tape all the time. And I'm like, well, yeah, but can we think of something more unique? I mean, we use tape all the time, but it's not tape. And then as I thought about it, I did think of something in the OR setting. And it's a retractor that we use. And it's in every set, every orthopedic set. There's certain instruments that come in the orthopedic set. And the Army Navy is a retractor that's in every set. And it's basically a long metal piece that has a long kind of forky end on one end. It's smooth, and then on the other end, it's a little bit shorter. And for whatever reason, it's called an Army Navy. I don't know why. That's just, we named that. But it's in every set. It's always there. We use it in so many of our cases. It's just such a versatile tool that we use. And I'm like an Army Navy retractor. I'm always there. I'm always ready to go. I'm always game for anything. Put me to work. Like that's just what I came up with is that. So I'm an Army Navy retractor.
Any situation,
ready to go.
Oh my gosh, that's so cool.
Yeah, I wish that an athletic trainer was in every setting, as it sounds like we are expanding into your setting in the ortho setting.
Yes. As I've been in the orthopedic setting in clinic, I've seen just in the last 8 years since I've been in the orthopedic setting, how much it has grown. And even in the industrial setting as well, athletic trainers going into the industrial setting. But I had vaguely heard in my schooling that athletic trainers were in the clinic setting and in the orthopedic clinic setting. But I didn't really, it was just always like a long-term, well, maybe I'll go into that at some point. Maybe some point I'll want to go into the clinic setting. But for right now, I'm going to be traditional and I'm going to stay at want to be in the college or high school setting. But in my mind, I always thought, well, maybe one day, but that one day came sooner than I thought it would for me to transition. And now I've just seen it grow even more.
That is so awesome. So here on AT Corner, we do love to kind of start off with stories or kind of intermix them and get that experience piece along with the education piece. Could you explain a little bit more about how that one day became your reality and how you became kind of what got you into this ortho clinic setting?
Yeah, so I initially, it took me a little bit to get into being a certified athletic trainer. So I did work in other healthcare settings for a minute. But then I was working as a certified athletic trainer at the college that I did my schooling at. And it was great. I loved it. I loved being invited back to working there with them. I had great athletic trainers I worked with, great mentors. I worked with their women's soccer team, track and field, and then we were a smaller school. So I got to see a mix of a lot of sports and athletes to work with, and I loved it. But then there were just some circumstances that were happening, and I just decided, well, maybe I should look for another position. And so I started to look for another position, and I saw a position open up for a clinic, ATC clinic, and they were hiring for 2 athletic trainers. And I didn't know if it would be with a sports medicine doctor or an orthopedic surgeon. I just applied for the position. And when I interviewed with them, they said, we have a sports medicine doctor and an orthopedic surgeon that we're interviewing for. And so I interviewed, and it's kind of funny. I was on a soccer trip with my women's soccer team when I got the call, and they're like, can you meet with us on Monday morning? I'm like, well, I get in at 3 a.m. on said Monday morning, and then had to drive. I'm in Utah. I had to drive up to northern Utah, which is about a 4-hour drive.
Oh, no.
And so I get in, then I immediately I had somebody drive me up so I could sleep for a little bit.
That's a good idea.
Oh, it's awesome.
And I went into this interview and, had the interview, didn't think anything of it. I'm like, I don't know if I'm qualified for this. I don't know. We'll see. And so I left just kind of, we'll see what happens. And then they called me a couple hours later and they said, we want to interview you to meet with our orthopedic surgeon and see if that would be a good fit. Just because I did have some background as an orderly in the hospital setting and in the physical therapy clinic as well. So I had a kind of diverse background in those settings. And so I went and I interviewed again with the orthopedic surgeon. I guess they said they thought that I had some good potential and they hired me because my orthopedic surgeon knew he was going to have to teach me a lot because I didn't have any traditional training in the OR at all. So he was going to have to train me a lot. So I made it into the orthopedic clinic a little bit sooner than I was planning to. I wanted to be in the college setting for maybe a little bit longer, but that didn't pan out. And I've been now in the orthopedic setting for about 8 years. And it's been great. Lots of fun, lots of learning. And I get to see a lot of things that I didn't think that I would be able to see. So.
Wow, that's awesome.
That's really awesome that the ortho was open to that and having an athletic trainer.
Yeah, he had in his training, in his residency and fellowship. He did back in the Midwest, like in Michigan, Wisconsin. It's kind of where he got his training. And then down in Louisiana where he did his fellowship. He had seen athletic trainers in the clinic and in the OR setting. So when they offered him this job and they said, we can hire a medical assistant for you and an athletic trainer, he knew that, if I can, I want to take the athletic trainer with me into the OR. And so he was willing to take on that challenge of training somebody, which I think is really great. For him to do and see that potential in the athletic training profession that we are capable of going into the operating room.
Yeah, that advocacy is really cool. That's really cool to hear.
Yeah.
So you mentioned you were an orderly in the past. Can you explain a little bit more of what an orderly is?
Yes, so an orderly is not quite a CNA. It's maybe we're maybe a step below a CNA,
Mm-hmm.
but you're basically there in the same day surgical services.
Mm-hmm.
So either in pre-op, post-op, or up in the OR setting,
Mm.
helping to turn over the operating rooms, transporting patients, helping patients get ready for surgery, making sure they've got their gown on, their compression socks on, things like that, helping the nurse get things ready, and then transporting them if they need to go to different areas of the hospital. So I worked in a pretty busy hospital as an orderly. We had 24 operating rooms.
Oh,
Wow.
wow.
So we would go through, I mean, 90, sometimes up to 100 patients a day for surgery.
Wow.
So
Oh
we
my
were
gosh.
constantly transporting patients up to the surgical floor, turning things over, coming back down, assisting in PACU, helping in post-op. And so I got to see the flow of how an OR works and the
Mm-hmm.
team and the people that it takes to make sure that patients are taken care of, and just the whole process and the flow of that. And so now, as I've worked in the OR setting now for 8 years in a little bit more of an elevated role,
Mm-hmm.
I still remember back to my orderly days of being, someone that's like, hey, go grab this, go get this. And sometimes I feel bad asking, hey, can you go get me this, when I know I'm capable of going
Yeah.
and getting it.
Right.
I know where it's at. But yet we're all a team, and it's
Mhm.
all a
Mm-hmm.
matter of, hey, if I can help out here, I'm going to help you out here. But if they can help me here. So it's just, I just know, and I have such good respect and rapport with the orderlies we do have in the OR, because I was there once and I know what
For sure.
that feels like. So that's what an orderly is. And so I can kind of say I started really down at the bottom and have just worked my way up in the healthcare professions. So
But that's a great perspective
Mhm.
that you're able to like see firsthand.
Other staff,
Right.
other roles.
yeah.
You brought up how the transition into your clinic OR position wasn't as planned as you were hoping for, as you were initially
Mhm.
planning. Can you explain how that transition was from going from a setting that most ATs and most programs kind of prepare you for into something that was very new?
Yeah, so the transition for me, I would say it was hard in a lot of different respects. It was hard leaving the traditional setting where I had done all of my training as an athletic training student, working with
Mm-hmm.
that specific population of athletes, and the camaraderie that you get from working with other athletic trainers as well, and transitioning to a clinic setting where you're the only athletic trainer.
Mm-hmm.
You work with your physician, you have your physician, you maybe have another athletic trainer that's in the clinic, but they have their other physician that they're working with, seeing their own patients. You're seeing your own patients. And now you're working with a wide variety of patient care, not just those high level
Mhm.
athletes. Now I'm seeing 60 to 70-year-old patients coming in with, chronic knee pain, arthritis, and they have a wider range of health morbidities that I didn't have to deal with
Mhm.
and know about. I mean, in the college setting, now I have to look at their medication list and see what medications they're on, and all these things that the athletic training profession sets you up for, to
Mm-hmm.
be successful in knowing a wide range of, all the medical knowledge that we
Mhm.
have. But in a clinic setting, you really have to broaden that a little bit more when you're working with a broader population than just athletes. And I think that transition was really hard in the beginning of just having to learn all of those little nuances of just working with a wider population and working with a surgeon. They're great, but you've got to really like focus in on your communication with them. So
can you kind of touch on what like your kind of day-to-day tasks are, like for a clinic or even maybe on an OR day?
Yeah, so on a clinic day, I typically will make sure that all of our imaging for the day is ordered and ready to go so that when the patient comes, we can just get whatever x-rays they need that day so there's not a delay in that. So I make sure and go through our schedule and make sure all the imaging is ordered. If we have any new patients, I make sure and look through their imaging to see if we need to order new ones, what imaging they do have in there, and kind of get an assessment of, maybe what we might be dealing with. Like, say I have a knee patient coming in and they already have x-rays and an MRI. I'll go through and I'll look through the images. I'll look at the MRI and see like, oh, they have an ACL tear from a skiing injury. This is likely going to be surgical. So we'll check their range of motion and see when we can get them in and set up for surgery. So then I can kind of give my doctor a heads up as we get to that patient of, okay, this is what this patient's presenting with, and we go on from there. But I make sure all imaging and everything is good. And then throughout the day, I go into the rooms with my doctor. I scribe for him. I start all of his notes for him, scribe, and then I'll order any additional testing or anything else that needs to be done for that patient. And then if it's a surgery, then we get some surgical forms filled out. I talk with my surgery scheduler, and then she goes in, talks with them, and then we get on to the next patient. And so it's a really like ebb and flow of go in, see the patient, doctor comes out, this is what we're doing, and then we go on to the next one, next patient. So it's a lot of repetition in the clinic setting of that. But I work with a really good team of, we know each of our roles. My doctor can come out of a room and we know exactly what to do is next. And so clinic, you try and make it as efficient as possible, especially for your doctor. So if I have all of his notes ready to go for him, I have patients set up, I can give him a quick synopsis of what the patient is dealing with. Then hopefully the visit can go a little bit more smoother. So
for one thing that fascinates me is the ordering of images, because one setting that I was at, our team physicians allowed us to put in the order for like x-rays, but like, I don't know what x-rays they like views they wanted. So I would always still have to ask like, hey, what views do you want? Do you kind of have that same thing, or do you kind of already have an idea of, oh, here are the views he's going to want, or he or she are going to want, and like you can punch them in?
Yeah, so that is definitely something that I have had to learn from my physician of what views that he wants. So I know what views, and I mean, I have a cheat sheet of the views that he specifically wants. But now I don't nearly have to reference that cheat sheet because I'm pretty sure of what views we need at what times. But I had to learn like the difference between what AP knee looks like and a PA flexion knee looks like, and just all these different views that I didn't have any clue what that was coming out of schooling. So he's definitely helped teach me a lot about imaging and what we're looking for. Because there's sometimes you look on x-rays and you're like a clavicle fracture, and you can clearly see that's a fracture. That is broken. That's a broken bone. But there's some things like on x-rays that I'll try so hard. I'll be looking at it and I'm like, okay, well, I think that the break might be there, or we might be looking at this, and I think I'm headed in the right direction. And then he'll take a look at it and he'll be like, oh yeah, this is what we're looking at. This. And I'm like, oh my gosh, wow. Like, my eyes are not yet trained like like yours, but I mean, he's had way more years of training than I have, but I definitely have learned a lot more. So for you, I mean, for a lot of athletic trainers that get told like, oh yeah, put in these x-rays, you might not know what it is, but
Right.
I think that's just something that I've just learned over the course of working with my surgeon that's been fascinating, is just all the imaging and specific imaging that help us get the views that we want. Even in the operating room, it's really interesting. We just fixed a clavicle fracture this last week. Poor kid just blasted through his clavicle. There were so many pieces. It's like putting a puzzle together in there.
No.
And we use x-ray in the OR setting to make sure that we're getting things as lined up and as close as possible. And so even in the operating room, like getting the specific views that we need to make sure we're seeing all the right angles, to make sure that, like there was one piece that was maybe still kicked out a little bit. So we went back in, adjusted some things, and then took x-rays. Okay, that looks a little better. And then, we go on from there. So it's just really interesting just to see that, how everything comes together, and with imaging and what you're specifically looking for.
That actually brings up a really good point in how much of your role now would you have been able to do right out of school versus how much have you learned on the job?
I think right out of school, I could have gone in and evaluated a patient, and that's about it.
Wow.
I could have written the SOAP note, evaluated the patient and written a SOAP note and given my idea of what was going on. But especially right out of school, I feel like that I could do that. But now with the years that I've had, the knowledge and learning that I've had, I definitely feel more confident, even just from taking a history from a patient of specifically what questions to ask, that help me and help my physician kind of form the diagnosis of what they could have. Because we see a lot of patients that come in with chronic pain, that my shoulder's been bothering me for years. Well, that can be a broad range of things. Right. And so asking them, was there a specific event that you remember, and things like that. Like, I know I've gotten better at my history taking. I've gotten better at my evaluation skills, imaging. So everything over time has just added up that has grown that confidence as a clinician. But right out of school, jumping into a clinic, I would have had to learn so much and build that confidence. But I think us as athletic trainers, that's what we're good at. We're good at asking the questions. We're good at learning and kind of learning on the fly and on the job of what's going to work best in that setting that we're in.
Were there any additional, like maybe certifications that they required you to at least acquire? Yeah. During your time there? Yeah.
So before I could go in to the operating room specifically, I had to take a sterilization class, like to help me learn the proper sterilization technique in the OR, so that I knew how to scrub properly. I knew how to gown and glove properly to not contaminate myself or contaminate the field. Which, believe me, when I was first going into the OR, I did. And it's something that everybody does it, and you just learn from it. If you bump something or touch something, then you have to change things. But you go through this course in this class to kind of help you, but there's still going to be those moments. So I had to go through that class and pass off to make sure that I knew those proper techniques. And then my physician wanted me to learn suturing so that I could help close. And so I took a suture class, which I love now that they offer that as part of the
Mm-hmm.
curriculum in athletic training is suturing. And so I had to take a suturing class. And then my physician also continued that learning just in the OR and showing me how he wanted things closed. So once I had the basics down, then he started kind of teaching me a little bit more advanced closing techniques of what we use all the time in the OR now. So those are the two that I needed, and then of course, like I had to keep up my licensure and my certification as well. But those are the only classes that they required of me. So
Nice. When you had to get those, did your employer help with those? Like, did they give some financial assistance, or was that kind of on your own?
Or was it through your
Or
employer?
yeah, it was offered through my employer, so they offered the classes and set up the classes for me. That kind of all the new hires or people that needed those classes, we all would just go to those classes. So my company, that my employer that I work for, they offered that, and then once you had that, then you were good to go with that. And even surgical centers that we've been to that are somewhat tied to the hospital that I work with. When we started going to more surgical centers, I again just had to go through that recertification process to show my proof of I have learned these techniques. And then if they needed any additional things, then I would just go through that and they would just provide that for me. But I definitely have had to learn the credentialing process to get credentialed in, which is another thing that I never really thought about. But that's definitely something as an athletic trainer going into the operating room, you need to be aware of the credentialing process that you have to go through. So
Interesting.
So you said you also do procedures as well in the clinic.
Yes.
Was that something that you learned from your from the doc that you work with, or is that like specific, like under his standing orders, or how does that work?
So that's something specific that I learned from my doctor. The procedures that we do in the clinic is we give steroid injections in the clinic. And then sometimes every once in a while we have a wound that maybe we need to clean out. And so then we need to just get the tools that we have in the clinic, sterilization kit type OR kit that we have in the clinic that has a scalpel and different things in there that help clean out the wound. But those are all things that I learned through my physician is that, and I typically will just draw up the medication that we need for that, and then he'll administer the injection. But our sports medicine doctor, he does a lot more ultrasound guided procedures. And I've had the opportunity to work with him a little bit too and see that process of him using the ultrasound to do different types of injections. He does PRP injections, platelet rich plasma injections as well. And so they'll draw the blood up and then spin it down and then re-inject it in. So I've seen that process, and I've been able to watch him do those procedures. But being an orthopedic surgeon, he's more like, well, give you an injection, but ultimately we might be headed to surgery. So if they need the other type of procedures, we just send those to our sports medicine doctor. So,
Oh, that's cool.
So you also mentioned that you were the only athletic trainer at your specific clinic. Have you heard of other places that have more than one athletic trainer, or do you know a lot of other athletic trainers in a setting similar to yours?
So we did hire an athletic trainer for a sports medicine physician. So he
cool.
also has an athletic trainer. So they're also in our clinic, but we're kind of a satellite clinic to our bigger sister clinic that is a little bit further away, just a little bit from us, that they have a few more physicians and they definitely have more athletic trainers in that clinic setting. And the employer that I work with, they do hire quite a few athletic trainers. They're definitely one of the bigger employers in the state of Utah that has athletic trainers in the clinic setting, and in the outreach for high schools and colleges. So there are quite a few of us that work in the clinic, but I don't know of very many that do clinic and the operating room. I think just within my group, there's probably 3 of us that do that transition from clinic into the OR on a weekly basis. So
All the things that you were talking about, like the retractor and stuff like that, did you learn that in your course that kind of helped with the sterilization, or did you learn that on the job, or did you learn that from asking, or how did you get that kind of knowledge?
I've learned that on the job and asking. The surgical techs that I work with are my best friends. They really have become such great mentors. A lot of them, there's a few that I have worked with since I started in this job, and they have helped and mentored me, and giving me advice of, how to do things. And I'm so grateful for that, because I didn't know what Army Navy was the first time I stepped in. And then it was put in my hand and off we went. And then I've had to learn like all the names of the retractors, just kind of through the job and asking and learning what they're specifically for. I still some days get some of them wrong because they can go by so many names too. That sometimes I call it by the wrong name, and then they're like, "Oh, did you mean this?" I'm like, "Yes, I meant that," because I know it as the other one. But all the surgical techs I work with are great, and I have worked with a number of them for quite a few years. So they just have been really good to work with. And also our reps that we work with that come in and help us with the surgeries, that bring in all the implants. There was a particular rep that we worked with for our total knees for a number of years, and I worked with him since I started, and then he moved into a different territory. But he helped me so much in my knowledge of what I should be doing to assist my physician in the OR, and just getting better at that. And so I'm so grateful for them as well, because like I'll be sitting there getting an ACL graft ready on the back table, and the rep is like, "Okay, Hailey, then next we're going to do this, and then make sure, and then you're going to do this." And they're just so great to like guide me through on things and help me. That I really appreciate that. So there's a lot of different influences. I mean, not only my physician has been a huge influence with helping me expand my knowledge base. I ask questions, and he's such a good teacher, such a patient teacher. I really couldn't have asked for a better orthopedic surgeon to work with, just because of his patience and willingness to teach me a lot. But it's just taken surgical techs, my doctor, and then my own self of taking notes and readings, and things of just building and expanding my knowledge base.
That's amazing. That's really cool. So with all of that you know now, is there anything that you wish you knew when you started your position at the ortho clinic?
Oh, this is a question that when you sent me, I was stuck on. I'm like, I don't know. I wish that I always said that I wish I knew more about imaging. Even when I was going through school, I wish I knew more about the imaging side, because I would have athletes come in and they'd be like, "Oh, I had this done, and they'd show me like pictures, and I'm like,
Mm-hmm.
I don't know what that looks like. I don't know what
Mm-hmm.
that is. I don't know what's going on. And then they'd give me an x-ray report or an MRI report, and I'm like, I think I know, but I don't know. And so I wish that I had a better knowledge of imaging headed in to this clinic setting that I'm in now. But at the same time, I am so glad that I didn't, because I've been able to just learn so much more about
Mm-hmm.
it, that now my knowledge base is just, I don't know, just expanded. But I wish I did know a little bit more, because then I would have felt like, okay, I know what this image looks like, and I know
Mm-hmm.
what we're looking at here. But now I can look at an x-ray, and I can kind of start to piece together. And sometimes I'll even look through the MRI on my own before my physician
Mm-hmm.
has looked at it, or before we've talked about it, and before I've looked at the report. And I'll look through the MRI, and I'll try so hard to pick up, like, okay, is there a meniscus tear? Okay, what does their ACL look like? What does their PCL look like? What are we looking at here? And try and figure out what's going on before I go and look at the report. And I think that has helped. So I'm kind of trying to teach myself
Mm-hmm.
a little bit more, so that my eyes are getting trained better of what to look for. And I'm getting better. I'm getting
Nice.
better. But still, again, my physician, he'll look through it, and I'm like, I swear I looked at that image so many times, and I didn't pick up on that. But his eyes are just better trained, and so I just got to get caught up to him now.
Yep.
It really does make such a difference working with a physician who takes their time and shows you what they're looking at versus just kind of goes through the motions. Like even in the traditional setting, like you said, like people will bring their MRIs or images, and sometimes I'll send them over to our team physician. And I've had some team physicians who will like call me and be like, okay, do you see this on the bone? This is what this is, and this is what I'm looking at, and this is why it's concerning or why it's not concerning. And then I also have physicians who I send it to them, and they're like, thanks. Cool, it looks like this.
Yeah.
It's like, oh, I don't feel like I can really ask questions and like learn from you. You're just gonna kind of tell. So it's really cool that you get to have that experience of working with that physician and really asking those questions and learning.
Yeah, like I said, I know that I really lucked out with being able to work with the physician that I work with. Even the physicians that I worked with when I was at the college setting, they were really good. Like our sports medicine physician, he was great. He would take the time to kind of walk you through things, and he'd help us a lot in making sure, like if there was like an ACL tear, that everybody got to feel it, and help us like with our technique of testing for ACLs and just overall like evaluation skills. He did definitely help us a lot with that. And so I'm really grateful that I have been able to work with physicians that are willing to take the time. Even our orthopedic surgeon that we had at the college setting, he was great too, but sometimes you had to get him in the right spot to ask him a question. I mean, he was so busy in a lot of ways that sometimes you felt bad taking his time from him, but he was still good at explaining a lot of things. But I definitely truly know that if I didn't have this physician that I work with, if I didn't work with this physician that I do work with, that it would be a lot harder. But since I have been willing to learn and try and get better and improve my skills as a clinician, I know that he can see that and recognize that. So he's willing to put in the time to help me get better and improve my skills. And I'm so grateful for that. So he tells me, he's like, give me at least like a year's notice if you ever are leaving, because it's going to take a little while. And I totally get that, because I have worked with him for so long, and he's trained me to now sometimes in the OR, he doesn't have to ask for a specific thing. I just hand it to him, because again, I've learned his preferences and learned just how the workflow should be, that I know that that's the next thing that they need. And that definitely helps speed up the surgery, speeds up clinic, if I can just, also anticipate things. So sometimes it's funny that he'll just put out his hand and I just hand him what needs to be what's next, and he doesn't even have to ask for it. And I remember it was kind of funny, like early on starting, and he was always, okay, and this is going to be next, and then we'll do this next. I'm like, okay, and trying to remember all the steps of things. And he kept saying, one day we'll get to where you don't even have to ask, and you'll just hand me things. I'm like, I don't know if we're ever going to get to that day. That is never going to happen. There's like way too much going on. Well, now we're at that I can hand him things. We have gotten to that in some respects, that I just know what needs to be next and stuff. And it is helpful too for surgical techs in the operating room. Like, I went through a clinic day, but through a OR day, I get in there, I get into the room, I see who I have for my team. We don't necessarily have the same team every time on an OR day, but I see who I have for my team, see what needs to be done as far as room setup, what equipment we're going to be using for that day. Make sure that we have kind of everything that we need, because you don't want a delay in care for that patient of not having a specific instrument for that day. And so even planning 2 to 3 days or a day before, of making sure, will this rep have this specific implant there? Will we have this specific set there? Is also a part of my job, of making sure and communicating that we'll have everything in place so that we can have a successful surgery day and have everything there, because it just makes the day go so much smoother. Because I've had days where we don't have what we need, and it just doesn't make the day feel good. But I'll make sure everything looks good. The surgical tech or nurse will ask me some questions if we need anything else, or if everything looks good. And then I will say the biggest thing also in the OR is draping, like learning how to drape for the specific procedure. Something that I got so nervous about, because you want to make sure that you're staying sterile and that you're not contaminating things. But then you also want to make sure that you're not draping yourself out. You want to make sure that where the incision's going to be, that you're not putting drapes over where your surgeon needs to cut. That's not good. Right. So you want to make sure that the drapes are laid and put down in an orderly way, to make sure that the field where you're going to be doing the procedure is, not contaminated. It's not draped out. You don't have to make any adjustments. And I know that I've definitely gotten better at that. Again, my physician has helped me learn, the specific way of draping and keeping things sterile, and then just all the different tools in the operating room that we need. So then we get the procedure done. My surgeon will get to a certain point, and then he'll step out, and then I suture, and I'll close all of our cases, get all the dressings on. If a knee brace or a shoulder brace needs to be put on, I'll put that on the patient, and then help transport the patient over to the bed, and then go off to PACU, do the handoff to the PACU nurse, and then go on to the next case. So it's a very chaotic, but yet also, mastered plan of a day in the OR. Like, everybody knows their role, and everybody knows what to do next. But you always have to be ready for the possibility that something could happen, and just staying calm in those situations. Luckily, we haven't had too many of those, but that's definitely another aspect in the OR is just being aware and planning for if something happens and being prepared for that. So,
What kind of surgeries do you guys do?
so my physician, we do total knees, total shoulders. We do rotator cuff repairs, so a lot of shoulder scopes, rotator cuff repairs, labral repairs. We do a lot of knee scopes, ACL reconstructions, and then we do the occasional fracture care of clavicle fractures, ankle fractures. Interestingly, we have done triceps repairs for patients that have ruptured their triceps.
Wow.
Very rare, but very interesting surgery to see how that triceps is torn off the bone and then getting it to repair back down. And then just the rehab process with that. That's a unique one. Hamstring repairs. The water skiing injury. I actually have had, I think, 2 patients that have had the classic water skiing injury where they were water skiing and ruptured their hamstring tendon.
Really?
Wow.
And that's a pretty rough surgery to go through. But that's a unique one too that we don't get very often. But definitely all the total shoulders, total knees. We do quite a few of those and all the scopes associated with that. So we do quite a bit. And trying to think what else we do. He did his fellowship in orthopedic sports medicine. So he has done a wide variety of surgeries. And so I've had to learn a wide variety of cases. He also does hip scopes. That's another one that is really unique to see. Hip scopes that's one that learning about FAI with my surgeon and my knowledge base in that and how a patient presents with that and what we're looking for as far as imaging goes has been really, really fun to learn more about that because I look on an MRI and I'm like, okay, they have a labral tear, but do they have a cam deformity? Do they have, some overhang of the acetabulum? Like, what are we looking at as far as are they a surgical candidate or not? And do they have the classic signs for FAI? So that's been a really fun one to learn a little bit more about. And hip scopes take a lot of work. But it is pretty satisfying when the patient who's been dealing with pain for so many years gets that relief from that pain that they've been dealing with and are able to get back to their activity. So it's definitely rewarding to see patients that from the beginning of coming into clinic with so much chronic pain that they've been dealing with. Like I've seen patients with really bad arthritic knees and arthritic shoulders, and we do their surgery and we get them 3 months, 6 months down, and they are just happy with life because they've gotten that lifestyle back and they're able to get back out and do activities and be active. And they're just so grateful and happy that, that their surgery went well and that their recovery went well. And I mean, it is rewarding to see that patients are able to get back to their livelihood. So
That's awesome. That's really cool.
You ready for the action?
All right, let's do it.
So here on AT Corner, we love to have some action and something that we could take away from this podcast today. What advice do you have for athletic trainers who want to get into the ortho setting?
My advice for any athletic trainer who wants to get into the ortho setting, I would say, 1, have patience with yourself. And ask all the questions. Again, we go through our training in the traditional sense, and you might get a rotation that you get to see a clinic setting in, and that's great. If you have that opportunity, I would take it just so that you can see what that looks like, because it is different from the traditional setting. But And if that's something that you want to go into, then now there's so many fellowships that are offered for athletic trainers to help you be more successful in the clinic setting. I didn't have that opportunity. And sometimes I'm like, oh, I wish I had that opportunity. But at the same time, I think hands-on training for me has been the better way to go. And I'm so grateful for that. But I would just say, have patience with yourself. You're not going to know everything the minute you walk into the operating room. Make friends with the nurse, make friends with the scrub tech. They're gonna be your best friends and help you with that. But just have patience with yourself and ask a lot of questions. And hopefully, the physicians that you work with are willing to teach you and advocate for you as an athletic trainer.
Perfect.
Awesome. Thank you so much for this, Hailey.
Yeah, thank you.
Yeah, I enjoyed it. And happy Athletic Training Month. It's the end of March, but happy Athletic Training Month to everyone.
Yeah,
Yes,
happy
heck yeah.
National Athletic Training Month.
Yeah.
I think this is a perfect way to close it out.
There you go.
Athletic trainings in all settings.
Yes, exactly.
Yes.
So what I really took away from our conversation with Hailey was obviously the OR stuff. Like, that's really cool. But I think what's really interesting is you had someone who left a traditional setting, picked a setting that, like, especially at the time that she took it, was like completely new, not a lot of training for you. And like, just, it seemed hard, but she was able to do it.
And is continuing to.
Yeah. And is thriving.
And paving the way. Yeah.
Yeah. So I think I feel like that's really cool that, like, as an athletic trainer, like, we can do hard things.
We can do hard things.
You know, so that's what I really liked about that conversation. That's what I really felt from it. It's just like a setting that wasn't even really in our schooling. And here's someone who's thriving in it. That's just awesome.
I think it's really cool to hear, especially, I know from our side, but also from a physician or someone outside of athletic training who sees athletic trainers and says, I want to work with that.
Yes. Yeah. That one, advocacy, baby.
Yeah. That is really cool, because that physician could have been like, I want an MA or I want a PA, you know, but for someone to actually recognize the extent of the things that we are capable of.
Yeah.
It's pretty cool.
Yeah, absolutely.
So if you guys are new to our episodes, we do all of our episodes as either education episodes, interview episodes, or story episodes. We had a highlight interview for this episode, so you can find lots more, especially this season. We have a lot of interviews. You can find a lot more this season or in our previous 5 seasons, or you can find us through our CEU education episodes that Randy heads, where he reads a ton of research articles and brings them together. So we can converse on a certain topic, and they're good for category A CEUs. Thank you to our partners, Clinically Pressed and Athletic Training Chat. We also do story episodes, which we have a couple more upcoming. So make sure you look at our Instagram stories if you would like to submit your story. But we do take real life athletic trainers and stories from their experiences all over, because we know that this job is not one size fits all.
Very true.
And every experience can be so different from one person to another.
Yep.
I think that's most of what I have. Do you have anything else to add?
Nope, that's perfect. Thank you for helping us showcase athletic training behind the tape. Bye.